Too late for vaccinations to help North Korea, South Korea expert. The ongoing wave of Omicron infections in North Korea could cause tens of thousands of deaths in the unvaccinated country, says Dr. Myoung-don. Estimated that North Korea's Omicron death toll could reach 34,000 by the end of the current wave. He based his numbers on an April 15 CDC report and Hong Kong data. The US CDC report noted that the high overall mortality in Hong Kong was mainly driven by unvaccinated people aged 60 and up. The report said people in their 80s and older who have never been vaccinated had the highest mortality rate at 1.725%, or 17,250 deaths per million population. Unvaccinated persons in their 60s and 70s were 0.278, and 0.584%. Noted that 9% of North Korea's population, 2,409,986 adults in their 60s and older, are likely unvaccinated. North Korea lacks Hong Kong's excellent healthcare system, hence mortality rates might be greater. North Korea's pandemic is fast spreading, with almost 5% of its 26 million people reporting a fever since late April. Since May 12, when domestic cases were admitted, there have been 1,483,060 cases and 56 deaths. The North's official Korean Central News Agency reported 269,510 new cases of fever and 6 deaths in the last 24 hours. South Korean health officials said North Korea's reported case and mortality statistics are likely low. Lee Song-won, head of the CDC's Epidemiological Analytic Division, claimed North Korean fatalities may be underreported. Despite a large epidemic, North Korea's fatality rate per case is lower than in South Korea or elsewhere, he told reporters. Because North Korea lacks diagnostics for COVID-19, cases without symptoms go unreported, said Ministry of Health and Welfare spokesperson Sun Young-rae. More than half of younger Omicron patients had no symptoms, he noted. North Korea's reliance on a fever to weed out suspected cases also leaves significant loopholes, Sun added. 1 in 10 Omicron patients get a fever, he noted. South Korea's 0.13% case fatality rate is due to mass testing and high immunization rates, without which even Omicron may be lethal. Of the National Medical Center said immunizations wouldn't change much in North Korea's condition. He stated the epidemic started about April 15, weeks before the formal announcement. Even if the vaccinations arrived today, it would take a month for both doses to reach individuals and for the full protective benefits to kick in. Omicron will have peaked and caused harm by then. Antivirals and anti-inflammatory drugs, as well as over-the-counter medications like fever reducers, were urgently needed, he said. North Koreans may use non-medical alternatives due to a lack of essential medicines. The North Korean state-run newspaper Odong Sinmun recommended honey for coughing, willow tea leaf for other mild symptoms, and ventilating the room for breathlessness in a story published Sunday. Catholic University of Korea virologist Dr. Paek Soon-young acknowledged that the Omicron epidemic in North Korea is no longer vaccine containable. The 300,000-plus cases a day reported in North Korea is comparable to the 600,000 daily cases logged at the peak of South Korea's Omicron surge in March, he told the Korea Herald. In the event of a second or third wave of infection, North Korea will need the vaccines, according to Paek. Easily storable vaccines like Novavax may be better than mRNA, he added. North Korea refused vaccines and other aid during the pandemic. Dr. Choi Jung-hoon, a North Korean-trained physician, told the Korea Herald that North Korea lacks the cold chain supply and ability to monitor adverse events required for a population-wide vaccination program. Representative Tae Young-ho, a former North Korean ambassador to the UK, stated in Facebook postings that COVID-19 assistance to North Korea should be a complete package. This involves not just enough vaccine doses, but also the infrastructure to store and distribute them, he stated.